started as a hygienist. So I graduated from hygiene school and practiced hygiene, which I know you're a hygienist as well. Fell in love with dentistry, loved it so much, I kind of wanted to keep pursuing. So I went back and went to dental school, and I've been practicing several years now. Kind of a little bit more about me. I'm the mother of 2 boys and actually currently on my maternity leave right now. So this is actually really exciting to be known as Dr. Beebe and not mom for a little bit and talk shop again. So I love being here with you. And so being a mom is a big part of my life, but I just love dentistry, and we just moved to Washington. So I'm excited to get back to work when the time is right for my family, and maybe when I'm sleeping a little bit more too.
Wonderful. Thanks so much for sharing. So
Yes.
I am the EHE National Account Manager. As Dr. Beebe mentioned, I'm also a dental hygienist. I just don't practice clinically any longer. I'm really passionate about oral health and preventive health, so I feel like I've landed the perfect role at EHE. And dental and oral health are really essential parts of your overall health and well-being. While a cavity may not affect your endocrine system, severe gum disease could impact your health well beyond your mouth. Dr. Beebe, can you let us know some ways poor dental hygiene can affect more than just our mouths?
Absolutely, Ava. So there's kind of a term in, I would say, medicine and dentistry that the mouth is kind of a window to your health. And that's just because it's our first point of entry. And also, if we think about it, sometimes when we floss or things like that, the mouth can easily bleed, which can be an indication that things are not right. But what that is it's an entry into the bloodstream. And so a lot of times what can happen is there can be kind of chronic inflammation in the mouth that can carry on into the body. Or another theory too is that bacteria can get traveled into the bloodstream. So what does that mean exactly? A lot of things that the mouth can play a part in as far as the health of your body can be heart disease. There's actually a lot of research, and it's continuing to get better all the time, that the inflammation we see with gum disease can actually play a role on heart disease. Another part of that is dementia. Again, we know that dementia plays with brain health and also nerves. That bacteria can affect that as well. And also diabetes. So if you have periodontal disease, which we'll talk about that later, periodontal disease can also make it hard to control your blood sugar. And we know that with an autoimmune problem, immune problems with the diabetes, it can be hard to control health. So a lot of times people with diabetes are actually prone to having periodontal disease and gum issues. And another thing too for, women is it's also found if you have poor gum health that it can be connected to preterm low birth weight babies. So there's several things we're finding with research and experience that the mouth has to be taken care of. And it's one other way that we can help improve the health of your body.
Absolutely. I think that we shouldn't think of the mouth as a separate entity from the rest of our body, but really the gateway to good or systemic health. So
Absolutely.
steps can be taken to protect our oral and overall health.
So really what it comes down to is homework at home. The first thing we want to do is get in with the dentist, get into a routine and be seen, in the time frame you should. For a healthy patient, that's going to be 6 months, but people with these systemic conditions that are, it's more important for them to stay on top of their oral health. Like we talked about, the heart disease, dementia, diabetes. If you're pregnant or expecting, you're going to want to see your dentist a little bit more frequently. And with that comes some responsibilities and homework at home, which we'll go into. It's brushing, flossing, using the right type of products.
Yeah, absolutely. And then can you talk a bit more about types of dental and oral diseases that people might experience?
Yeah, absolutely. So I think a common one that most people know is gingivitis. So what is gingivitis? Everybody knows that as it's bleeding gums or gums that are red or irritated. Usually this happens when people just aren't quite doing enough of a job with their home care. So the nice thing about gingivitis is it's completely reversible. If we can get your home care under control with brushing, flossing, then we can reverse it. We can get that tissue to go back to health. But if that's not taken care of, or we have some other things in play, which it's kind of multifactorial, is periodontal disease. And as you know, I mean, you could knock this out of the park as a hygienist. Periodontal disease is not reversible. It's when we have bone loss and some pocketing that occurs that will harbor bacteria down around the tooth, which we've talked about before, can then easily enter the oral cavity and even the bloodstream. And like I said, it's not reversible, but there are some things that you can do to keep it under control and arrest that disease process.
Absolutely. And that's why it's so important to address and mitigate gingivitis at its onset so that it does not progress to the point where we have, bone loss and tooth loss. Can you talk about some symptoms of dental and oral problems as well?
Yeah, absolutely. I mean, the main symptoms can be some chronic inflammation, which would be red tissue. There can be bleeding. Of course, bleeding is always an indication that something just might not be right. So that's definitely something you'll want to talk to your dentist about if you're experiencing that. I think patients are also just very intuitive. Like if something doesn't feel right, I'm going to be blunt. If something doesn't smell right, there's also a smell associated with some of that bacteria that causes periodontal disease. If something doesn't seem right, then I always recommend reach out to your dentist, go see them, talk to your hygienist. Hygienists are so well educated that they're the ones that flag a lot of these problems that are indicators that something's not right.
Yes, and I think that a lot of patients spend so much time with their hygienists and really get attached to them. So they definitely value your opinion and your expertise as a hygienist.
Yeah, absolutely.
Can we also talk a bit about dental erosion?
Yeah, absolutely. And real quick, if I can share just a quick story. So when I was in hygiene school, you end up, as you know, you work on each other. That's how you learn. That's how you learn to clean teeth. That's how you learn to probe and check the gum health. And you even practice doing anesthesia on each other. And when I was in hygiene school, actually, one of my clinical instructors made a note. She said, your tongue looks really red and it kind of looks like a little bit swollen almost. And it was a really red glossy color. And she said, keep an eye on that. And if it doesn't get better, then I think we need to take a couple steps. So many times when you go to the dentist, they can kind of pick up on some clues. And those clues can lead to a diagnosis again. That's not just a dental thing. It can be a systemic thing. Long story short, that glossy red tongue can be an indicator of low iron. And low iron is what actually diagnosed I have celiac disease, which is a really severe gluten allergy. And so in return, it was my hygienist that actually helped me figure out what was going on with my body. So I think it's really interesting that, again, sometimes, we only go to the dentist when, hopefully we're going for those periodic problems, those routine cleanings. We can be checked up at those moments a lot more than when we just call our doctor when we're in need, if you're not having regular doctor visits as well.
Yes, that's a great point. And there certainly are oral manifestations of systemic diseases. So it's something that your hygienist and your dentist can pick up on, whereas, maybe your PCP doesn't necessarily look as in depth when it comes to, your mouth and the oral cavity. So thanks so much for sharing that.
Yeah, of course. And then to answer your question about dental erosion. So dental erosion is something that happens. The best way for someone who may be not living in the dental world is the teeth can kind of look a little bit flat. Usually our teeth have a lot of characteristics. They've got grooves and rolls and cusp and everything like that. What happens when you have dental erosion, which can come from food and beverages, anything that's acidic, is it actually damages the enamel and ends up flattening them. So a lot of times what can happen is if you're grinding your teeth with a lot of acid, it flattens those cusp tips off. And even sometimes if you notice when someone smiles, their teeth just look a little bit short. That's exactly what erosion is. So it can come from food and beverage. Also, it can be a side effect if you have uncontrolled acid reflux or GERD. So that's another thing where you kind of want to work hand in hand with your primary care physician and also your dentist. A lot of times people will ask, well, what can I do to prevent that? So limit your acidic foods and your beverages. You can use a straw that helps to bypass the teeth if you can kind of put it in the middle posterior area of your tongue, or you can switch with a little bit of water, kind of helping to rebalance that pH. And also this is kind of an odd suggestion, but you want to wait to brush your teeth. I think that often surprises people, but let's say you have a soda pop that is very acidic and you're going to go and brush your teeth. All you're doing is you're brushing that acid right into the teeth. So you actually want to wait a solid 30 to 60 minutes to let that pH neutralize. So you're brushing without that acidic environment.
Yes, absolutely. And then I guess the same thing would go, I guess, as well too, for any women who might experience, morning sickness associated with pregnancy. You wouldn't want to brush immediately afterwards. You'd want to maybe rinse out with some tap water and then wait a period of time before brushing.
Yeah, when I was pregnant, I had severe nausea and was vomiting a lot. So anytime I know someone has a health history, which could be pregnancy or any kind of other thing that may induce vomiting, I always say get one of those little travel size mouthwashes to keep with you, because after you throw up, you don't want to brush. You want to grab some mouth rinse, swish that around. If you don't have that, then water, just like you said.
Great. And then do men and women have to protect their teeth and gums differently?
Yes, absolutely. And really it's easy. It's just keep going to the dentist every 6 months. If you're concerned about that visit, then talk to your OBGYN and get a medical clearance. Your dentist can work together with your doctor to make sure they're treating you exactly how it should be done. But you can, because the hormone changes, even with women in menstruation, it can change the gum health a little bit. We can see a little bit more redness, a little bit more inflammation. So what does that mean? You just really have to stay on top of those regular visits, but more so your homework at home. Flossing and brushing becomes a bigger issue when you've got something else going on in your body. And if you're growing a human, you got a lot going on.
And Dr. Beebe, can we also touch upon how diet affects our teeth?
Yeah, absolutely. I think it surprises people that most often when I see people struggling with cavities, there's of course several things that go into it, but the common thing is snacking. People who snack, it's a great way to get cavities. Now, I'm not going to take snacks away because everybody needs snacks during the day, but it's about how you eat them. So the more you're exposing your teeth to foods such as carbohydrates and sugar, if you're exposing them multiple times a day, that's a better chance for you to get cavities. So what you want to do, instead of grazing on those snacks, you just want to eat them all at once. Eat the snack. Like you said, I love what you said. Grab a sip of water, swish it out, get some of the particles of food out, and then go on with your day, rather than the people who are nursing a beverage all day long, like, some type of beverage with sugar in it. Friendly reminder, coffees have creamer and sugar in them. So if you're nursing those and some type of snacks, again, that frequency is what can lead to a lot of cavities.
Yes. And then can you also talk about how smoking and drinking can affect teeth and gums?
Yeah, absolutely. So another part that goes into play with cavities and even the health of the tissue is if it dries out. People with dry mouth have a tendency, as you probably have seen, that gum tissue becomes so fragile when it dries out. Smoking is a great way to dry your mouth out. Alcohol, a great way to dry your mouth out. Again, those habits can kind of lead to drying out, which leaves you susceptible to cavities. But also those are types of things that can lead to stain, because wines and beer sometimes can stain. Sometimes those can be a little bit acidic as well. So that's going back to your conversation and question about erosion. But also those things can lead to oral cancer. And I might even add too, smoking and chewing tobacco can lead to oral cancer. So those are things you want to keep in mind if you are participating in those habits.
Yes. And then smoking can also lead to periodontal disease, bone loss, tooth loss. So it's something where we really want to kick that habit if we are heavy smokers.
Yeah.
And then finally, can we talk about the different types of oral care products that we should use? Maybe some products that you really like and stand by and recommend for your patients.
Yeah, absolutely. That's something I'm really passionate about. I feel like, I don't know about you, but even as a dentist, I go to the grocery store or to some type of market where you're buying your hygiene products. It is overwhelming. There are so many choices. I'm going to say almost too many choices. It makes it hard to decide. So I think what really it comes down to is really breaking up what are your concerns, and then finding the right products that fit that. So one thing that I love to recommend to patients, and I almost recommend it to every single patient, is an electric toothbrush. In your experience, Have you noticed people who use an electric toothbrush have better gum health and less stain and plaque? Have you noticed that,
Less
Ava?
stain, less plaque, less tartar, less bleeding, less inflammation. It really is such a beneficial, efficient tool for those who would otherwise use, a manual toothbrush that just can't physically remove as much plaque.
Yeah, absolutely. And to me, so the ADA came out with a statement through one of their, they have this Mouth Healthy website that they have, which is a fantastic resource if you ever want more dental information with a little bit of research behind it. A regular toothbrush is better than no toothbrush,
Mhm.
but it's all about who the brusher is, not necessarily the brush, but an electric toothbrush helps with that problem. An electric toothbrush buzzes around. And so as you're moving it, it's almost like you're covering 2 to 3 times the amount of surface area. So even though it's not like a magic solution, it just helps you to do a better job with what you're already doing. So I highly recommend first line of defense with your oral hygiene and the products that you're using is switch to a quality electric toothbrush. I always love Oral-B and Sonicare. Those are a very easy one to get and know that you're using the right one.
Yeah, absolutely. I think those are the two top of the line electric brushes out there. And I think
Yeah.
that especially for patients who struggle with brushing for an appropriate period of time, generally we want them to be brushing for at least 2 minutes each time.
Yes.
We don't necessarily realize how long 2 minutes is unless we have a timer there. So it might be a good idea to invest in one that has a timer on it as well.
Yeah. And I love that we're talking about people with also health conditions. Not always, but a lot of times those people are older. And as we get older, we have dexterity issues, and an electric toothbrush, again, helps with some of that lack and ability to move that toothbrush around if you are having dexterity issues. An electric toothbrush, again, is one way to do a better job, still keeping the same habits.
Yeah, absolutely. And then, can you talk a bit about like toothpaste and different maybe floss aids that patients might, need to use? Are you a fan of water flossers? What do you like?
Yeah, so I'm always going to recommend using a fluoride toothpaste. It's a very inexpensive way to protect your teeth against cavities. Usually there's 2 different types. There's a sodium fluoride, again, that protects against cavities, and there's a stannous fluoride that protects against cavities. Both are a really great option. We are finding that stannous fluoride is kind of beneficial with people with enamel erosion or gum problems. So that might be something you want to look into. Talk to your health team about that, especially your hygienists. I think hygienists are just so well educated on what products are available. And you also asked about floss. So flossing, you definitely want to do 1 time a day. And it's the dreaded question every time you go to the dentist. But the toothbrush can only reach so far under the gum line. It also doesn't pull all that food that you eat all day out from your teeth. So flossing is a great way to improve your gum health, your breath, and like we talked about, preventing periodontal disease that can't be reversed, that could lead to, like we talked about, tooth loss, bone loss. Flossing is a great way. And I love that you asked too. That is just the newest question with all the information available to people is, should I use a water flosser? If you're someone with gum conditions and struggling with that, and also if you struggle with dexterity, it's a fabulous tool to use to improve your gum health. Absolutely.
Definitely. And I also love the water flosser for those who have traditional braces or who maybe have dental implants or larger spaces in between their teeth. I find like it can be, easier for them to be able to remove more plaque and food debris than using traditional floss.
Yes.
So we learned that oral health is an indicator of overall health. Taking care to prevent oral health problems like gingivitis and periodontitis can go a long way toward decreasing the risk for more serious health problems. Thank you so much for joining us today, Dr. Beebe.
You bet. It was my pleasure. Thank you so much for having me.
Follow us on Facebook, LinkedIn, and Instagram for additional content. Thank you all for participating.